Fine. Once you are done with these 3 points, guys, last and final point, that is conclusion, climax of the story. Join the deep inguinal ring with the superficial inguinal ring. Join the deep inguinal ring with the superficial inguinal ring. It leads to the formation of a canal, and that canal is inguinal canal. Understanding here? So now start writing. Inguinal canal. Point number 1. It extends from deep inguinal ring to superficial inguinal ring. Inguinal canal, it extends from deep inguinal ring to superficial inguinal ring. Point number 2. What is the location of the inguinal canal, guys? It is located above and medial to inguinal ligament. It's located above and medial to inguinal ligament. I'll show you what is the meaning of this one. Please look at this diagram here right now, guys. Now in this diagram here, yes, yesterday also I have shown you what is this ligament here right now, guys. The name of this ligament here, inguinal ligament. And here you are able to find the deep inguinal ring here right now, and there will be a superficial inguinal ring. Join them together. This is inguinal canal. Where do you have the inguinal canal? Where do you have this inguinal canal? Above and medial. Above and medial. Above and medial to the inguinal ligament. Clear with this one? That 2 words are important, already given in the exams. Now guys, can anyone guess and tell me what is the length of inguinal canal, by the way? What will be the length of inguinal canal? Yes, right on there. The length of inguinal canal approximately will be 4 centimeters, but in your exam it seems he wants specifically 3.8 centimeters. I don't know what's happening in 2 mm, but you have to remember. Okay, so in your MC exam they have given the option as 3.8 centimeters. हम लोग हमेशा approximately will be learning as 4 centimeter, but in MCI he has given us 3.8 centimeter. Acha, forget about MCI. When you after MCI, if you prepare for PG, in PG exams they are giving like 3.75 centimeters. Oh, जिंदगी में कोई दूसरा काम ही नहीं है. Just keep on measuring inguinal canal. 3.75 centimeters. Okay, चलो. So inguinal canal is extending from deep inguinal ring to superficial inguinal ring. Location is above and medial to inguinal ligament, and then approximate length is 4 centimeter. Now after that, please write down the heading as boundaries. You have to learn the boundaries and content. Okay? Boundaries. And to learn the boundaries, what we are going to do is we are going to draw the diagram. So please start drawing the diagram along with me. There is a layer with oval shaped deep inguinal ring. And that layer will be transversalis fascia. There is a layer with the oval shaped deep inguinal ring, that is transversalis fascia. And then there will be a layer here with a triangle shaped superficial inguinal ring. And that layer will be your external oblique. Come on, draw the diagram quickly, guys. I'm going to remove this. And the deep inguinal ring, join that with the superficial inguinal ring. They are going to form a canal, and that is inguinal canal. Okay. Done. Now once you are done with this one here right now, inside the external oblique will be having internal oblique muscle, and inside that will be having one more, that is nothing but the transversus abdominis muscle. And what is going to happen to these two fascia, guys? The internal oblique aponeurosis is going to arch above and go here. It's going to arch above and go on the other side. And these two are going to meet together, and they are going to together form what, sir? They are going to form the conjoint tendon. What is the another name of the conjoint tendon? Falx inguinalis. And what is this conjoint tendon or falx inguinalis made up of? It is very clear in the diagram. Internal oblique plus transversus abdominis. Fine here. So we are in one layer we are having, like, in one layer you'll be having deep inguinal ring. Okay. So in the transversalis fascia you'll be having deep inguinal ring, and the external oblique you'll be having superficial inguinal ring, and join them together inguinal canal. Internal oblique and transverse abdominis, these two are arching above and going and meeting on the other side, conjoint tendon. Okay. And now welcome to our topic. What is our topic? Boundaries. Boundaries of what? Boundaries of inguinal canal. So my dear friends, concentrate on inguinal canal from here to here. Is it okay? Now what is going to form the anterior boundaries? Everyone, 1 second, stop writing and please look on the screen. 1 second, guys. So if this is inguinal canal, my dear friends, anterior to the inguinal canal, you'll be having external oblique and internal oblique. These two are in front of that one. In front of the inguinal canal, you'll be having external oblique and internal oblique. What do you have behind the inguinal canal? Inguinal canal ke piche, posteriorly, what do you have? Transversalis fascia and conjoint tendon. So transversalis fascia and conjoint tendon, these two are present posteriorly and these two are present anteriorly. Okay. So these two are present posteriorly and these two are present anteriorly. Is it okay? And what is present superiorly? Damn easy. You can clearly see in the diagram here. Internal oblique and then transversus abdominis is going above that. That is superior. And inferior to aapko already pata hai. Inferior you will be having the ligament. Which ligament? Inguinal ligament. So please start writing the boundaries right now, guys. Anteriorly, external oblique, internal oblique. Posteriorly, transversalis fascia, conjoint tendon, and then superiorly, what do you have? Superiorly, you'll be having internal oblique and transversus abdominis arching above that, going above that. And then finally, inferiorly, what do you have? Inferiorly, you'll be having inguinal ligament. Okay. So anteriorly you will be having external oblique and internal oblique. Posteriorly you will be having the transversalis fascia and conjoint tendon. Superiorly there will be internal oblique and transversus abdominis, and inferiorly you will be having inguinal ligament. So the boundaries of inguinal canal are extremely important and made easy. I hope it is done. Should I remove this? Sure. Now once you are done with the boundaries, the next thing is content. Come on guys, are you done? Perfect. And now welcome here right now, guys. Heading likho content. Now what is the content of inguinal canal? Yes, we need to learn the content of the inguinal canal in the male and in female. In male, what do you have, guys? Number one, spermatic cord, and number two, there is a nerve, and that nerve will be the ilioinguinal nerve. And in females, what do you have, guys? Number one, the round ligament of uterus, And number 2, ilioinguinal nerve. Okay. So in males you'll be having the spermatic cord and ilioinguinal nerve, and in the females you'll be having the round ligament of the uterus and ilioinguinal nerve. So, okay, fine here right now. Are you all okay? Sure. Now guys, once you're done with this one here, everyone observe here right now. Everyone just observe on the screen. I'll tell you what. First of all, look at this diagram. This diagram is actually in the female. In female, this is uterus, and we all know that uterus has got many supports. You know, broad ligament, round ligament and all. And out of many supports to the uterus, one of the support is round ligament. Follow round ligament. Round ligament is beginning from the uterus, passing through inguinal canal, and after passing through inguinal canal, it is coming out and merging with labia majora in the females. So therefore, round ligament of the uterus is a content of inguinal canal. Round ligament of the uterus is a content of inguinal canal. Done. Okay, done. And not only that, there will be a nerve present, and that nerve will be ilioinguinal nerve. And nothing to teach you about the nerve. You just have to remember the name of the nerve. Now, welcome to the males here right now, guys. In males, ilioinguinal nerve will be there. Okay, fine. Now, what is this spermatic cord? Ye kya hai, sir? Now, that itself is a separate topic. Now, I'll teach you it separately. Everyone listen here, sir. Guys, do you know one thing? In males, testis will be formed where? Testis form कहाँ पर होता है? Come on, my dear friends, start answering me. Very good. Arjun says the right answer. Testis will be formed in the abdomen. Very good, Rajkumar, in the abdomen. Fine. But what will happen? Testis will be formed in the abdomen. But during development, what is going to happen? The testis will descend down into the scrotum or the scrotal sac. Testis will descend in the scrotum or the scrotal sac. Fine. Why? Now the question mark is why. Why is the testis descending down? Now, my dear friends, the testis will descend down the scrotal sac. Why? Because, yes, in the scrotum, temperature will be 2 degrees less than that of the body temperature. In the scrotum, temperature will be 2 degrees less than that of the body temperature. Okay. And that less temperature is required for spermatogenesis to occur. That is the reason why, yes, the testis will descend down to the scrotum. Okay. So for spermatogenesis to occur, that is why what will happen? The testis will descend down. Suppose in some people what will happen? They will have undescended testis. The testis will not descend down. Then what is going to happen? The testis will remain in abdomen and at body temperature. And at body temperature, what is going to happen, sir? Spermatogenesis nahi hota hai, and the fellow will remain infertile. Is it okay? So the overall story here, the kahani here is that the testis has to descend down. Testis has to descend down. Okay. Testis has to descend down. Okay. Now, from where will it descend down? So that is the question now. Okay, we understood the testis has to descend down, but from where? Kahan se descend hoga? So my dear friends, remember, the testis is going to descend from the inguinal canal here. Right? Okay. From the inguinal canal here. Right? Acha, if it is descending down, artery will be going from here only. Vein will be going from here only. Nerve will be going from here only. And not only the testis is going to form spermatozoa. A spermatozoa is going to come out from here only via a duct. Ductus deferens. And all this artery, vein, nerve and duct will be surrounded by 3 fascia: external spermatic fascia, internal spermatic fascia, and in the middle there will be cremastic fascia. I repeat again: external spermatic fascia, internal spermatic fascia, and cremastic fascia. And all these 3 together, along with these contents, artery, vein and nerve, together it is known as spermatic cords. Okay, so learn conceptually, guys, don't mug up. Many students I am seeing is spermatic cord, they're just trying to mug up with certain mnemonic and all. Not at all required. Everything in relation to test. Start writing. Spermatic cord. Number one, what is the artery that is supplying to the testis? Testicular artery. What is the vein that is going to drain the blood from testis? Pampiniform plexus of vein. That means it's not a single vein, guys. What is the meaning of plexus? Plexus means network. Pampiniform plexus of vein. Number three, nerve. Genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve. I hope you are able to recall. Yesterday only I taught you somewhere femoral branch of genitofemoral. And then there is a duct here right now. So what is the name of the duct? Ductus deferens. Ductus deferens. And then these three will be surrounded by three fascia. External spermatic fascia, and in the middle you will be having cremasteric fascia, then internal spermatic fascia. So all this artery, vein, nerve and everything. The testicular artery, there is no problem with the lagging right now. Just I already explained you, keep on writing. Artery, testicular artery, vein will be pampiniform plexus of vein, and then genital branch of genitofemoral nerve, ductus deferens. All these structures will be surrounded by three fascia. External spermatic fascia, internal spermatic fascia and cremasteric fascia. And together they are going to form your spermatic cords. Guys, confirm me if you're done. Pampiniform plexus of vein. Pampiniform plexus of vein. It will be a network of vein. If you are still getting confused, let me show you the diagram here. Look at this diagram. In this diagram, can you see one artery coming here? Testicular artery. Can you see a network of veins here? Network means plexus. Pampiniform plexus of vein. Can you see a nerve coming here? Genital branch of genitofemoral nerve. And then there will be a duct coming out from here. And there is ductus deferens. All this artery, vein, nerve, duct, everything will be surrounded by fascia. Three fascia. Okay, perfect. Crystal clear. And now once you are done with that one, guys, look here. Can you listen to me now? Now that completes the concept of inguinal canal and all the things related to that one. And now welcome here. Just now we have learned that there are three muscles coming from the lateral side, sir. External oblique, internal oblique and transversus abdominis. There are three muscles which are coming from the lateral side: external oblique, internal oblique and transversus abdominis. Apart from that three muscles, we even have one big muscle in the middle. And what is this muscle? This muscle is rectus abdominis muscle. Rectus abdominis muscle. And then there will be a small muscle here right now below, and that muscle will be pyramidalis muscle. So there are two muscles in the center. One will be rectus abdominis, another one is pyramidalis. There are three muscles coming from the lateral side. There are three muscles coming from the lateral side. And the three muscles coming from the lateral side will be external oblique, internal oblique and transversus abdominis. And then there are two muscles in the center, and that will be rectus abdominis and pyramidalis. And please recall, in the very beginning of the class I told you, all the aponeurosis will come in the center. They are going to form a sheath, and that sheath in the center will be the rectus sheath. Okay. There will be 3 aponeurosis coming from the sides, and that 3 aponeurosis are going to form a sheath, and that sheath will be rectus sheath. Hello everyone, what is the issue? Now can you listen to me? Now, now listen here right now, guys. Okay. So what is going to happen here is that, you know, the 3 muscles which are coming from here, their aponeurosis is going to form sheath here, and that sheath will be rectus sheath, and that rectus sheath will be surrounding. The rectus sheath will be surrounding these 2 muscles here. Right now. What are the 2 muscles in the center here right now? Pyramidalis muscle, okay, and rectus abdominis muscle. Pyramidalis muscle and rectus abdominis. Pyramidalis muscle and rectus abdominis muscle. Fine here. So these 2 muscles are surrounded by the rectus sheath. But the problem is, if I have to see the arrangement of the 3 aponeurosis, if I want to see the arrangement of the 3 aponeurosis, what I have to do right now, I need to take a transverse section here right now. Let us take a transverse section. And once you take a transverse section, the diagram will be something like this. Try to understand what is this muscle here right now. This one is rectus abdominis muscle, and on the other side rectus abdominis muscle. And in the middle you will be having linea alba. And these are the 3 muscles which are coming from the lateral side, external oblique, and then there will be internal oblique and transversus abdominis. And these 3 muscles, external oblique, internal oblique and transversus abdominis, these 3 muscles, their aponeurosis will come here, and they are going to form a sheath here right now, and that sheath itself is known as rectus sheath. Is it okay? I repeat again, listen here right now, guys. External oblique, internal oblique and transversus abdominis. I repeat again. External oblique, internal oblique and transversus abdominis. These 3 muscles, their aponeurosis will come here, and they are going to form a sheath here, right? Rectus sheath. I'll just repeat for the last time here right now, guys. These 3 muscles, external oblique, internal oblique and transversus abdominis, these 3 muscles will come here, and they are going to form a sheath here right now surrounding the rectus abdominis. Okay, rectus sheath here. So therefore, now my dear friends, out of this complete diagram here right now, let me just zoom this much diagram. If you just zoom into this much diagram, it will be something like this. Perfect. So please start writing the notes now. Rectus sheath. It is formed by aponeurosis of external oblique, internal oblique, transversus abdominis. Rectus sheath, it is formed by aponeurosis of external oblique, internal oblique and transversus abdominis. Next one, sir. Arcuate line. Now, where do you have this arcuate line? The arcuate line will be between and pubic symphysis. Arcuate line will be between the umbilicus and pubic symphysis. Now, my dear friends, please again look at this diagram here. In this diagram, somewhere here we're having umbilicus here, and this will be the pubic symphysis. Umbilicus and pubic symphysis exactly in the middle here. Exactly in the middle here, you'll be having an imaginary line here, and that imaginary line will be the arcuate line, sir. Now guys, why am I telling you about this arcuate line right now? Why? Because above the arcuate line, arrangement of rectus sheath will be different, and below the arcuate line, the arrangement will be a little bit different. Are you getting my point here right now? So why is that arcuate line important, guys? First of all, try to locate arcuate line. Arcuate line is between the umbilicus and pubic symphysis. Arcuate line is between umbilicus and pubic symphysis. Okay, identified. Above the arcuate line, arrangement of rectus sheath different, and below the arcuate line different. That is the reason why I need to take two transverse section. One transverse section above arcuate line, another transverse section below the arcuate line. One transverse section above the arcuate line, another transverse section below the arcuate line. Is it okay? Fine here right now. That is the reason why we are having like two diagrams here right now, guys. So let us start drawing those two diagrams. Please write down the side heading here as boundaries. Boundaries of rectus sheath. And first heading you write down there as above arcuate line. Above arcuate line. Start drawing the diagram along with me very quickly. Rectus abdominis on one side, and then this is the rectus abdominis muscle on the other side. Then you'll be having the three muscles from the lateral side: external oblique, internal oblique, and transversus abdominis. And now, what is the arrangement of the aponeurosis here, guys? The external oblique aponeurosis will be going anteriorly, and the transversus abdominis aponeurosis will be going posteriorly. And the internal oblique aponeurosis will be dividing here into one lamina anteriorly, another lamina posteriorly. I hope you're not getting confused with the anterior posterior. This wall of the rectus sheath here will be the anterior wall, guys, and here I don't know why some of the students will be getting confused. Some of the students will be cross questioning, okay sir, this is above na sir, superior. Hello, this is not superior, this is actually anterior. We are taking which section? Transverse section. We are taking which section? Transverse. So therefore, what is this anterior wall made up of, guys? Anterior wall is made up of external oblique, comma, internal oblique. And what is this posterior wall made up of? The posterior wall is made up of internal oblique, comma, transversus abdominis. Is it okay? So the anterior wall is made up of external oblique, internal oblique, and the posterior wall is made up of internal oblique and transversus abdominis, and that is above arcuate line. Let us see the arrangement below arcuate line. Okay, and now my dear friends, just look at this diagram here. Rectus abdominis, and this one is the external oblique, internal oblique, and transversus abdominis. And I can clearly see external oblique going from the front, and transversus abdominis going from behind, and internal oblique we can see it is dividing into anterior lamina and the posterior lamina. And below the arcuate line, all the three, guys, external oblique, internal oblique, and transversus abdominis, all the three are going from the front only, anterior. So chaliye, let us draw this diagram. Rectus abdominis, in the middle linea alba, and there are totally three muscles here right now, guys: external oblique, internal oblique, and transversus abdominis. And now what is going to happen is the external oblique aponeurosis is going from the front here, internal oblique aponeurosis is also going from the front here, and then the transversus abdominis aponeurosis is also going from the front here. And therefore, what is forming the anterior wall of the rectus sheath external oblique, comma internal oblique, comma transversus abdominis. All the three of them are forming the anterior wall below arcuate line. And what about the posterior wall here right now, guys? Nothing. There is no posterior wall at all, sir. The posterior wall will be deficient. You can clearly see in our diagram. Is it okay? So these will be the boundaries of rectus sheath. Let me know if you're done with the diagram. We will go ahead with the contents right now. Very good. Should I remove the diagram, guys? Should I remove the diagram? Okay, chalo. And now please write down the last and final thing, the contents of rectus sheath. Rectus sheath will consist of two muscles. Already you people know, I don't even have to teach you. Rectus abdominis muscle. Very good. Another one is pyramidalis muscle. Chota wala muscle, hai na? Very good. And then there will be two vessels. Which two vessels do you have? Already I taught you day before yesterday in our thorax topic. Try to recall. There will be superior epigastric artery. याद आ रहा है कुछ? Artery as well as vein, and then inferior epigastric artery and vein. Yes, my dear friends, I'll repeat again. Do you remember our thorax topic that we have learned? In thorax topic, already I taught you internal thoracic artery will end by dividing into two branches, superior epigastric, musculophrenic, and superior epigastric artery will enter into the rectus sheath. So there will be two vessels, superior epigastric and inferior epigastric, present inside the rectus sheath. And once you are done with this one, what about the nerve right now, guys? What about the nerves? Nerves will be the lower 6 thoracic nerve. I mean to say from T7 to T12. Lower 6 thoracic nerves, and this is all about the contents of rectus sheath. So there are two muscles, there are two arteries, there are two veins, and then about the nerves, the lower 6 thoracic nerves will be present in that muscle. And by this we complete the anterior abdominal wall. Hello my dear friends. So from last 40-45 minutes we have been discussing only about anterior abdominal wall and the concepts related with that one. In the anterior abdominal wall we are done with the rectus sheath, okay, we are done with the inguinal canal, okay, and then we are done with a small concept known as spermatic pod. So everything in the anterior abdominal wall done. Are you okay? Are you all okay with this? Gracie madam, arcuate line is between, it is just an imaginary line, it is between umbilicus and pubic symphysis. Bharat, lovely, I love you too. चलो सर, अब हम बढ़ते हैं आगे. लेट्स गो अहेड नाउ टू पोस्टीरियर abdominal wall. Posterior abdominal wall. Posterior abdominal wall is easy, sir. It is made up of 4 muscles. Everyone please stop writing and look at the screen. There will be one muscle here which is known as the psoas major muscle, and there will be a small muscle here known as psoas minor muscle, and then this big part of the bone here is ilium, and the ilium bone will be having a beautiful muscle iliacus, and then there will be a rectangle shaped muscle here, and this rectangle shaped muscle here will be the quadratus, and it is in the lumbar region. Quadratus lumborum. And you can clearly see all these 4 muscles together, they are going to form the posterior abdominal walls. All that 4 muscles are together going to form posterior abdominal wall. 4 muscles. Number 1 muscle will be psoas major. फैसल कुछ नहीं सर, ऑलरेडी मैंने पढ़ा दिया है, नोट डाउन। फैसल लिखो, श्वास मेजर, श्वास माइनर, quadratus lumborum and iliacus, 4 muscles. Okay, and that is all done about the posterior abdominal walls. Okay, and by this I started our today's class by the concept that first we are going to learn about this abdominal wall, anterior abdominal wall and posterior abdominal wall, and many important conceptual things has been completed. Inguinal canal, rectus sheath, everything is done. And after learning about the abdominal wall, now let us enter inside the abdomen and learn about the organs. You know, the stomach, the liver and all those organs we are going to learn. But before that, I'll give you, 1 or 2 minutes of time. Okay, please revise this and then we'll go inside the abdomen together. Yes, अंदर की पढ़ाई। तो एक बार रिवीजन कर लीजिए, फिर हम करते हैं अंदर की पढ़ाई। All these things, shall we begin now? I hope your revision is done. Hope your revision is done. Sure. Now let us enter inside and then let us learn about the organs one by one. So first let's begin with the easy topic, guys. सब जब से ना बहुत hard topic हो गया है last 1 hour, और difficult topics done. Let's begin with easy topics. Stomach. Stomach. Guys, one thing to be very clear in the stomach topic or in any organ, remember, in your MC exam, they will not ask you all that simple stuff, what is the shape of the stomach, what is the capacity of the stomach, all these things they will never ask you. Whatever they will ask you, I'll teach you only those points, and just remember only those points. Simply don't unnecessarily waste your time. मैं आपको जितना बता रहा हूँ बस उतना ही पढ़िए, ठीक है? So come on, let's begin. In stomach, the relations of the stomach are more important. What is related to lesser curvature of the stomach? Lesser curvature of the stomach will be attached to a omentum, and that is known as lesser omentum. And what is related to greater curvature of the stomach? Greater curvature of the stomach will be related to greater omentum. Lesser curvature will be related to lesser omentum, and greater curvature to greater omentum. So do one thing, draw a diagram. Esophagus, greater curvature, and this one will be the lesser curvature. Lesser curvature will be attached to one omentum here, lesser omentum, and greater curvature will be attached to one omentum here, and that will be greater omentum. And now just add up here right now, guys. What will happen here? There will be diaphragm, and esophagus is going to cross the diaphragm and come here, and behind here you'll be having what? Behind the stomach you'll be having a spleen. And now, my dear friends, there is a ligament between the stomach and the spleen. Obviously gastrosplenic ligament, and there will be a ligament between the stomach and the diaphragm here, and this one will be obviously gastrophrenic. Anything related to diaphragm will be phrenic. Okay, so these two ligaments you can clearly see, they are also related to which curvature only? Greater curvature. So therefore, what is related to greater curvature? Gastrosplenic ligament, and even the gastrophrenic ligament. Okay. So lesser curvature will be related to lesser omentum, and the greater curvature will be related to greater omentum, gastrosplenic ligament, and gastrophrenic ligament. Are you done? Should I remove this? Come on everyone, are you all done? Good. And now once you are done with the relations to curvatures, my dear friends, now what is the relation to surfaces? Yeah. Listen here, stomach has got like two surfaces. For example, I'm having my stomach here right now. If this is my stomach here right now, there is an anterior surface and then there is a posterior surface. No need to learn anterior surface relation. Why? Because what is there in front of the stomach? अगर यहाँ पर stomach होगा तो stomach के सामने क्या होता है? In front of the stomach I'm having anterior abdominal wall, and that no one will ask you. No need to learn anterior surface relation. Only learn the posterior surface relation. So please write down the heading there as posterior surface relations. And the posterior surface relation of the stomach is very famously known as the stomach bed relation. Posterior surface relation of the stomach is also known as stomach bed relation. Posterior surface relation is also known as the stomach bed relation. And try to remember that with the help of a mnemonic. There is a Dr. SSS. Dr. SSS. And this waste fellow killed a patient, and that too mercilessly. Wow, what a mnemonic. Actually now there are so many structures here, so I don't want you to mess up. तो हम लोग क्या है ना कुछ help लेते हैं. Let us take the help of Dr. SSS killed patient mercilessly. Dr. D stands for diaphragm, and then S stands for splenic artery, and one more S here stands for the splenic flexure of colon. And one more S here stands for the suprarenal gland. Okay. Suprarenal gland means adrenal gland. Adrenal gland is also present behind the stomach. अच्छा जी. अच्छा कौन सा वाला adrenal gland? Is it the right or left? Right suprarenal or left suprarenal? I don't know why you people are thinking for so long. Definitely it will be the left. We are learning what? Posterior surface relations of stomach. Stomach के पीछे. And यार stomach कहाँ पर है? Left में है. तो stomach के पीछे क्या होगा? Left suprarenal gland होगा. And not only that, there will be kidney. Left kidney will be present behind the stomach. And then patient P stands for pancreas. And finally, mercilessly, M stands for mesocolon. Which mesocolon? Transverse mesocolon. Transverse mesocolon. Okay? So now do one thing here. I don't want you people to simply mug up this one, guys. This entire list. चलिए सर हम लोग maximum try करते हैं कि we'll try to cover maximum number of organs in the diagram. So this will be esophagus and then stomach and then duodenum. And duodenum will be C-shaped. First part, second part, third part, fourth. And behind here मान लो कि यहाँ पर spleen होता है. यार pancreas कहाँ पर होता है? Where is pancreas? Pancreas is inside the duodenum here. But you know, this is the head, neck, body, and finally the tail of the pancreas will be in the hilum of the spleen. Oh my god. Pancreas is going from duodenum up to the spleen. Done? And now, look here, look here. If you people are done with the diagram, then I'll go ahead. Yes, listen here. And now, first of all, how come diaphragm is present behind the stomach here right now, guys? First of all, you'll be having a stomach. And just tell me what is the shape of diaphragm? Diaphragm का shape क्या होता है? Dome shape. Now if the diaphragm is like dome shape, so you'll be having a stomach here and dome shaped diaphragm is going behind the stomach. Okay. Yes, diaphragm is present behind the stomach. Posterior. Because it is dome shaped. Then guys, in the center here, you'll be having abdominal aorta. And within few minutes, I'm going to teach you that. Abdominal aorta will give a branch. I'll tell you exactly कहाँ से आएगा. But remember, it is giving a branch. Splenic artery. Splenic artery has to go to spleen only. लेकिन कहाँ से? Stomach के पीछे. Behind the stomach, it is going to the spleen. Okay, splenic artery. Yes. Now look at this logic here. Duodenum will be from L1 to L3. And almost will be the same extent for kidney also. Kidney will be from T12 to L3. T12, L1, L2, L3. T12, L1, L2, L3. So therefore, our kidney is also present almost at the same level. T12, L1, L2, L3. And above the kidney here, you'll be having a gland and that will be suprarenal gland. पक्का. अगर kidney होगा तो adrenal gland तो होगा ही होगा. ठीक है? So my dear friends, what I am trying to tell you is that listen to my logic here. Apply this trick here. Duodenum will be from L1 to L3. Duodenum is from L1 to L3. And exactly at the same place we'll be having kidney also. Kidney will also be from L1 to L3. Okay, na? So above the kidney, definitely adrenal gland. So I don't even have to explain you right now. Do you have left suprarenal gland behind the stomach? Yes. Do you have left kidney behind the stomach? Yes. Do you have pancreas behind the stomach? Yes. And now? And now once all these organs are done here right now, guys, chalo, this is something like a little bit more in depth. Listen here. This is duodenum. After that we'll be having jejunum. And jejunum will go and end into the, ileum. Ileum will end into cecum. Duodenum, jejunum, ileum. Ileum will go and end into cecum. Cecum will, yes, move up, ascending colon, and then there will be transverse colon, and then there will be descending colon. My dear friends, listen here. Ascending colon is taking a turn here. What is this flexure? What is this turning? There will be liver here. That is by hepatic flexure. Transverse colon is taking a turn here and becoming descending. Transverse become descending. And this turning here is known as flexure. Which flexure? Splenic flexure. And where do you have this splenic flexure? Obviously behind the stomach. So splenic flexure of colon behind the stomach ke piche. And then this is transverse colon. Attached to that will be mesocolon. Transverse mesocolon. So therefore splenic flexure of colon. Splenic flexure of colon, yes, and even the transverse mesocolon, yes, is also present behind the stomach. So behind the stomach we have all these organs, all these structures, and it's one of the very, very important thing in the stomach. Posterior surface relations of the stomach, guys. Done. So basically I'm done with the relations of the stomach, sir. Relations to lesser curvature, greater curvature, posterior surface. All the relations are done in the easiest manner possible. And now welcome to the arterial supply. Arterial supply. Along lesser curvature. Along lesser curvature. Right and left gastric artery. Along greater curvature. Okay. And along the greater curvature there will be right and left gastroepiploic artery. Not only this, you'll also have the short gastric artery. Okay. Chalo, make a note of all these arteries, guys. Virender is asking, like, spleen is not posterior. Absolutely not. If it is given in any book, it's wrong. I can give you n number of references from standard textbook. It's given wrongly in many MCQ books and all. Spleen is not a posterior relation. Done. Bharat, curvature once please. What curvature, bhai? I have removed the written wala part, Bharat. What do you want? Chalo sir, यहाँ देखो. Now what about the arterial supply along the lesser curvature right and left gastric artery? अरे यार तुम हद कर रहे हो यार. Curvature क्या होता है? In the stomach you will be having this curvature here. This curvature will be lesser curvature and this curvature of the stomach is greater curvature. हो गया. Greater curvature, lesser curvature. Okay. Yes, greater curvature has two ligament, gastrosplenic ligament and gastrophrenic ligament attached to that. Okay. Come on, sir. Let us see the arterial supply wala part. Arterial supply wala part. Now imagine this one to be the esophagus here. It is a greater curvature and this one will be the lesser curvature. Along the lesser curvature there will be two arteries. What are the two arteries along the lesser curvature? Right and left gastric artery. So therefore guys, remember this one is the left gastric artery and this one is the right gastric artery. left gastric artery, and then there will be a right gastric artery. Along the lesser curvature, there will be right gastric artery and left gastric. Done. Now along the greater curvature, there will be two more arteries here right now, and from here this will be left gastroepiploic artery, and from here this one will be the right gastroepiploic artery. Gastro का मतलब होता है stomach, epiploic का मतलब होता है omentum. Gastroepiploic, it is supplying to both stomach as well as omentum. And then there will be small arteries here, and these small arteries here will be the short gastric artery. Short gastric artery. ठीक है. Along the lesser curvature, you will be having right and left gastric artery, and along the greater curvature, you will be having right and left gastroepiploic artery, and then short gastric artery. That is all that you have to remember about the stomach problem. That's all. Virendra is asking, gastroepiploic artery किसकी branch है? Virendra, hold on. Just have some patience. I will tell you every branch. Don't worry. Within few minutes हम वही करने वाले हैं. Okay? जब तुम पागल हो जाओगे. Hold on. Have some patience. And this is all about the stomach to be remembered. Sure. Next one. Welcome to diaphragm, sir. Next topic. If you are done with the stomach topic, now welcome to the next topic, that is diaphragm. Diaphragm, we all know that it is musculo-tendinous structure. Musculo-muscle, and there will be a tendon in the center. Diaphragm has got a central tendon. There will be a tendon in the center, you know. So musculo-tendinous structure. Okay. Is that relevant right now? Till what time do we have class today? It is a musculo-tendinous structure, guys. You will be having the muscle, and then there will be a tendon in the center. Musculo-tendinous, muscle and the tendon, central tendon. And then remember, what is the nerve supply? Now this is something really important. Okay. What is the nerve supply into diaphragm? Diaphragm will be supplied by phrenic nerve. Phrenic nerve. Now phrenic nerve, every student will know. What is the root value of the phrenic nerve? What is the root value of the phrenic nerve? Yes, it will be C3, C4 and C5. And that's something really dangerous. Why? Look here, sir. Our diaphragm will be normally present here. Diaphragm यहाँ पर होता है. And C3, C4, C5 will be present here. And from this C3, C4, C5, yes, phrenic nerve is coming all the way from neck and from thorax and then coming and supplying to diaphragm. Oh my God. So diaphragm, nerve supply, phrenic nerve, problem with the root value. Root value will be C3, C4, C5. It's coming from here. That has been asked in the MC exam. Take care about that. And now, my dear friends, look at this diagram here right now. Look at this diagram of diaphragm. Diaphragm will be having like muscles, and then there will be a central tendon. And now it has got like three major openings. Number one, opening for inferior vena cava. Inferior vena cava coming from below. Vena cava opening. Number two, there will be opening for esophagus coming from above. Esophageal opening. And number three, there will be aorta coming from above, and then there will be aortic opening. So, vena cava opening, esophageal opening and aortic opening. Vena cava opening, esophageal opening and aortic opening, sir. So, please write down there, the side heading there as the major openings of diaphragm. Major openings of diaphragm. Major openings of diaphragm, sir. Number one, you'll be having vena cava opening. Number two, you'll be having esophageal opening. And number three, you have got the aortic opening. There will be vena cava opening, there will be esophageal opening and aortic opening. The first thing that you need to remember is the level. Which opening is found at which level, sir? Vena cava opening will be at the level of T8. Esophageal opening will be at the level of T10, and aortic opening will be at the level of T12. Wow. So easy to remember. Vena cava opening will be at T8, esophageal opening will be at T10, and then aortic opening will be at T12. It's like 8, 10, 12. Even numbers, easy to remember. Okay. What do you want? Vena cava opening, and then esophageal opening, and then aortic opening. So it will be at T8, T10, and T12. 8, 10, 12. But the problem, what is the problem? Every student during the classes just concentrate on this number as 8, 10, and 12. Okay. And during the exam, they will forget that which opening will be present at 8th one. सबको number अच्छा याद रहता है 8, 10, 12. But the problem is 8th वाले पर कौन सा opening, 10th वाले पर कौन सा opening, and 12th वाले पर कौन सा वाला opening. And to remember that, remember the very famous mnemonic which each and every student remembers. Yes, Voice of America. Okay, and if you hate America, Voice of Anatomy. Is it okay? So vena cava opening, esophageal opening, and aortic opening. Vena cava opening, esophageal opening, and aortic opening. So there are 8, 10, 12. 8, 10, 12 we can remember easily, but remember about the, yes. Oh, thank you. And once you are done with the level right now, sir, whenever you have any opening, what are the structures passing? This is important. What are the structures passing, sir? Vena cava opening, it will be obviously inferior vena cava. Everyone knows that. Write and forget about that. No one will ask you. Vena cava opening, inferior vena cava only. Along with that, what is passing? There will be right phrenic nerve passing. Done. So if I am at your place, I am not at all going to learn inferior vena cava. Please learn phrenic nerve. The right phrenic nerve will be passing from there. So esophageal opening, what is going to pass? Esophagus. Along with the esophagus, remember vagus nerve is also passing. So I always advise the students to remember like a rhyming word. Esophagus, vagus. Esophagus, vagus. Esophagus, vagus. Okay. And then finally, what about the aortic opening? Aorta is going to pass along with. Along with aorta, azygous vein. And along with the azygous vein, even thoracic duct is also going to pass. So always try to remember the other ones. And I can assure you one question definite in the June exam from this topic. Okay. So vena cava opening, inferior vena cava, along with the right phrenic nerve. Esophageal opening, esophagus, along with vagus. Aortic opening, aorta, along with the azygous vein and thoracic. Are you all done? Okay. Now once you are done with this topic here, sir, now let's start. We are done with the stomach, we are done with the diaphragm. Let's start with the abdominal aorta. Abdominal aorta. In abdominal aorta, first of all, you got to remember the extent of the abdominal aorta. Abdominal aorta कहाँ से कहाँ तक होता है? अरे यार, just now we have seen aortic opening कहाँ पर होता है? Aortic opening will be present at T12. And right at the aortic opening, what is happening? We have been learning this from school days. Our thoracic aorta is going to become abdominal aorta after crossing diaphragm. I repeat again. Abdominal aorta is nothing but the continuation of your thoracic aorta, but once it crosses, what's the diaphragm? Diaphragm cross, and where it is crossing T12. So therefore, abdominal aorta is going to begin from where only? T12. T12, L1, L2, L3, L4. Abdominal aorta will be up to L4. So abdominal aorta will be starting from T12 and it will be extending up to L4. And at L4, what is going to happen? The abdominal aorta will divide into common iliac arteries. It will divide into common iliac arteries. So abdominal aorta will extend from T12 to L4. Done. And once you are done with the extent, guys, the next thing that we need to learn is about the branches given by the abdominal aorta. And now, please look at me here right now. If suppose this is abdominal aorta here, it's giving branches from almost every direction. There are certain branches given from the front, ventral branches, from back, dorsal branches, and from sides, lateral branches. Ventral, dorsal, lateral. Ventral, dorsal, lateral. So let us see all the branches in a diagrammatic manner. Imagine this one to be your diaphragm. Imagine this one to be the abdominal aorta. And this abdominal aorta is starting from T12 and going up to L4. Now, first of all, let us see what are the ventral branches. Hope you're ready. There are totally like 3 ventral branches. Right at the level of T12, there is one ventral branch given, and that is celiac trunk. At L1, one more ventral branch is given, that is superior mesenteric artery. And leave L2, welcome to L3. At L3, one more ventral branch given, that is inferior mesenteric artery. So what are the 3 ventral branches, guys? Celiac trunk, superior mesenteric artery, inferior mesenteric artery. Celiac trunk, superior mesenteric artery, inferior mesenteric artery. Okay? So simultaneously we'll do one thing. Along with this, we'll even write on the notes also, guys. So ना मेरे साथ में notes भी लिखो. Branches of abdominal aorta. First category, we are going to write down ventral branches. And what are the 3 ventral branches given here? Celiac trunk, superior mesenteric artery, and then inferior mesenteric artery. Celiac trunk is given at the level of T12, superior mesenteric artery L1, and then inferior mesenteric artery is given at the level of L3. And now the most important thing, the celiac trunk is going to supply to the entire foregut. Superior mesenteric artery will be supplying to the entire midgut. Inferior mesenteric artery will be supplying to the entire hindgut. Foregut, midgut, and hindgut. Hope it is done. Now welcome to this diagram again, sir. As I told you, we are having branches in almost every direction, ventral, dorsal, lateral. So we are done with ventral, now lateral. Laterally, guys, there will be totally 4 branches. There will be one artery which is given to the diaphragm. Anything given to diaphragm will be phrenic, and this is from below. Inferior phrenic artery. Inferior phrenic artery. I just now told you our kidney will also be from T12 to L3. Just above the kidney will be the suprarenal gland. There will be an artery supplying to suprarenal gland, and that will be obviously middle suprarenal artery. Next one, I don't even have to explain you, that will be to the kidney renal artery. And the next one and the hot favorite one, the important one for your MC exam will be gonadal artery. Recently they have asked in the exam. But you know, this gonadal artery, the same artery in the males will be known as testicular artery, and the same artery in the females, it will be known as the ovarian artery. Why? Because the male gonads will be testis and the female gonads will be the ovaries. And all these 4 branches that we have written here, all these are which branches, guys? Lateral branches of abdominal aorta. So I repeat again, there are totally like 4 lateral branches. Number 1, inferior phrenic artery to diaphragm, middle suprarenal artery to suprarenal gland, renal artery to the kidney, and then gonadal artery to the gonads, the testicular artery and the ovarian artery. Ovarian. Pranshu Gupta, ovarian artery. And now I am done with the ventral and lateral. Now please write down the heading as dorsal branches. Dorsal branches na पीछे होती है. They are actually present behind. So I can't draw in this diagram here right now. Just write down 4 pairs of lumbar arteries. There will be totally 4 pairs and lumbar artery. Dorsal branches behind will be 4 pairs of lumbar artery, and then there will be only and only one median sacral artery. Okay, so be careful. There are totally like 4 pairs of lumbar artery, and there will be only and only one median sacral artery. Finish. I will do one thing here. I'll repeat all the names once. Please cross check in your books, guys. Abdominal aorta is extending from T12 to L4. Question number 1. Now ventral branches. Ventrally 3 branches. Celiac trunk, superior mesenteric artery, inferior mesenteric artery. हो गया. Laterally we'll be having 4 branches. Inferior phrenic artery, middle suprarenal artery, renal artery, gonadal artery. Dorsally we'll be having 4 pairs of lumbar arteries and 1 median sacral artery. 1 median sacral artery. Abhijit is asking the level of renal artery. Yes, Abhijit, the renal artery will be almost at the level of L2. Okay? And now let us learn about the celiac trunk and then the superior mesenteric artery and inferior mesenteric artery in detail, their further branches. So please write down the heading there as celiac trunk. Heading likho, celiac trunk. Guys, celiac trunk will be supplied to which gut? Foregut. And now let's see what will be the branches and everything. So please write down the heading there as celiac trunk. Celiac trunk आपको ना already introduction पता है. It is a ventral branch of abdominal aorta. It is given at which level? T12. It will be supplied to which gut? Foregut. आपको ये सब पता है. And now please welcome directly to the branches of celiac trunk. There are totally main 3 branches given by celiac trunk. And what are the 3 main branches of the celiac trunk will be? The left gastric artery. Number 2, you will be having the splenic artery. And number 3, you will be having the common hepatic artery. There will be left gastric artery, and then there will be splenic artery, and then there will be common hepatic artery. Okay, there will be left gastric artery, there will be splenic artery, and then there will be common hepatic artery. left gastric artery, splenic artery and common hepatic artery. And I am going to teach you in the order of difficulty, guys. So सबसे easy one will be the left gastric artery, dangerous one will be, a moderate one will be splenic artery, and dangerous is common hepatic artery. Are you ready? Everyone, are you ready? Chalo. And now, my dear friends, imagine that this is like one page in your book. Okay, this is like your page. Why I am telling you like this is, please now draw the diagram exactly as I am drawing, sir, and wherever I am drawing. जैसे मैं ड्रॉ कर रहा हूँ वैसे ड्रॉ कीजिए सर. खतरनाक डायग्राम. This image was given in your MC exam. Basically we are going to draw this image right now. ये वाला image हम draw करेंगे. चलिए, let's get started now. On the left side here I'll be having stomach, and the right side I'll be having liver. So first I'm drawing the left side. ठीक है. Esophagus, greater curvature, duodenum. First part, second part, third part and fourth part. Behind here you'll be having what here, sir? Spleen. And imagine this one here to be your pancreas. And somewhere in the middle I'll be having the abdominal aorta. And for example, if we are at the level of T12, right in front, what is this one? Celiac trunk, and that is the hero of the story. And if this is done here right now, on the right side what do you have, guys? On the left side there will be stomach, on the right side what do you have here? Liver. So on the right side here you'll be having like and you people all know that liver will be attached to gallbladder. Done? Now guys, in this topic I'll tell you very clearly before itself. I will tell you this topic a little bit slowly. I will tell you all the branches at once, and you people also try to be with me and write it at once. If you ask me again and again, it will be confusion. Okay? So please start writing the branches with me. Celiac trunk is going to give rise to like 3 branches. Out of that, the first one is left gastric artery. Let's finish this. Celiac trunk will give the left gastric artery, and it is going along the lesser curvature. And this left gastric artery, on the way, it is giving only and only one branch to the esophagus, and these branches will be esophageal branches. Left gastric artery. हो गया sir, done. Finish. Left gastric artery is the easiest one, and it is giving only one branch, that is esophageal branch. I am done with the left gastric artery. Now welcome to the splenic arteries. Splenic artery is also a branch of celiac trunk, and it has to go to the spleen. And just now we have learned that it is one of the stomach bed relation. It is going from behind the stomach, and it is going to the spleen here right now, and this will be the splenic artery. Okay, splenic artery. Now this splenic artery, while going to the spleen, when it is going to the spleen, on the way, it is giving three branches, and this you people have to listen carefully. It is the splenic artery. While going to the spleen, it is giving like three branches. The branches to pancreas, pancreatic branches, and there will be small arteries here. What is the name of the small arteries? Short gastric artery, and there will be one long branch here right now, and this will be left gastroepiploic artery. I repeat again, what are the three branches given, guys? What are the three branches given by splenic artery? Number one, pancreatic branches. Number two, short gastric artery. And number three, left gastroepiploic artery. I think someone was asking me, sir, left gastroepiploic artery किसका branch होता है? Welcome now. Left gastric artery is a branch of splenic, and splenic artery is a branch of celiac trunk. Celiac trunk is a branch of aorta, and aorta is coming from heart. Enjoy. Done. Yes. And now, my dear friends, welcome to the dangerous one. I am done now with the splenic artery also. Khatarnak and the dangerous one, common hepatic artery. Celiac trunk is giving the third branch, that is your common hepatic artery. Guys, from the name itself you can understand it is like common. और यार हम सबको पता ही है, we are almost into the last class of anatomy today. हम सबको पता है जहाँ पर भी common आता है it will further again divide. Common hepatic artery is again going to divide, and out of that one of the arteries is going towards the liver, and because it is actually going towards the liver, proper hepatic artery, and it is giving one more branch, and that branch is going from here, and that is going actually ना यहाँ पर से पीछे से, behind the first part of duodenum, and you can clearly see that this artery is actually between stomach on one side and the duodenum on the other side. Gastroduodenal artery. Which artery? Gastroduodenal artery. Chalo, I'll repeat once more for you people. Everyone please observe here, stop writing. Common hepatic artery is dividing into proper hepatic artery towards liver, and one more artery here between the stomach here and duodenum here. Stomach and duodenum, in the middle we are having gastroduodenal artery. Gastroduodenal artery. And now, first of all, let me finish off with the gastroduodenal artery, guys. This gastroduodenal artery is going to end here, and it is ending here by dividing into two branches, and out of that two branches, one branch you know, one branch I know. The one branch which is going along the greater curvature of the stomach, the right gastroepiploic artery. And there is a one more branch which is going here, and that branch is between duodenum and pancreas. So therefore that will be superior pancreatico duodenal artery. It is between the pancreas on one side and duodenum on the other side. Pancreatico duodenal artery, that to superior. So therefore, my dear friends, the gastroduodenal artery is ending. It is ending by dividing into two branches: right gastroepiploic and superior pancreatico-duodenal. And now welcome to the proper hepatic artery. Proper hepatic artery is going towards the liver. And this is like easier one, guys. After going towards the liver, it will be dividing into two branches. One will be the right hepatic artery, another one is the left hepatic artery. Out of that right hepatic artery and left hepatic artery, right hepatic artery will give a branch to the gallbladder, and this branch which is going to the gallbladder will be the cystic artery. Anything related to the gallbladder will be cystic artery. I repeat again, proper hepatic artery will divide into the right hepatic artery and left hepatic artery, and out of that right hepatic artery will give a branch cystic artery. And now we are done with this diagram, except for one more branch right now, guys. Yes, look here right now. Do you remember lesser curvature? Along the lesser curvature will be having two gastric arteries, left gastric artery, right gastric artery. On the screen you are able to see left gastric artery. What about the right gastric artery? Right gastric artery is a branch of, boliye. No common hepatic. Remember, the right gastric artery will be a branch of your proper hepatic artery. So proper hepatic artery is going to the liver. Before going there, it is going to give a branch backwards, and this branch will be the right gastric artery. Enjoy with confusion. That completes your topic of celiac trunk. And my dear friends, just imagine this diagram was given as an image based question last December, not this December, before this, previous December 2018 exam, MCI. I am telling you, this image was given as an image based question, and in that they have just marked the arteries as A, B, C, D, name the artery. Practice the diagram after the class. Okay. Virender, I told you very slowly. Koi locha nahi hai. What is the locha? What is the problem? Left gastroepiploic artery is a branch of splenic. Right gastroepiploic artery is a branch of gastroduodenal. हो गया. So show image. Image सामने है ना आपके? Sohail, the image is in the front. Break will be after 10 minutes. I have sent the images in the group yesterday itself. Are you all done? Are you all done? Shall we go ahead? Good. Now guys, tell me, celiac trunk will be supplying to which gut? Celiac trunk is supplying to which gut? Foregut, midgut or hindgut? Foregut, है ना? And now let us do the easier one, sir. Welcome to the next one. The midgut. Midgut will be supplied by superior mesenteric artery. So therefore, now let us study about superior mesenteric artery. Superior mesenteric artery will be supplying to midgut, and for that we need to draw the diagram of midgut. So let's begin with the midgut diagram. This one is cecum attached to appendix. Cecum continues above ascending colon, and this one will be the transverse colon, and this will be the descending colon. Okay, ascending colon, then the transverse colon and descending colon. Now this one here will be the first part of the duodenum, second part of the duodenum, third part. First part, second part, third part, and the fourth part of the duodenum. Inside the duodenum, you will be having the pancreas. Now after duodenum, what do you have guys? After duodenum, you'll be having like jejunum, it will be just coils, and finally after that ileum. Ileum will go and open into cecum. And here, imagine somewhere in the middle, superior, aorta here, an abdominal aorta, and in front of the abdominal aorta, if we are at the level of L1, we'll be getting superior mesenteric artery, and that's the hero of the story here. Superior mesenteric artery is given at which level, sir? At the level of L1. Superior mesenteric artery is given at the level of L1. And now we have to first of all identify what is our midgut. Midgut कहाँ से कहाँ तक होता है? Midgut will be starting from the second part of duodenum. Then it will include the duodenum, jejunum, ileum, cecum, ascending colon, transverse, and transverse only up to the right 2/3. Right 2/3. This is midgut, and the branches are so easy. चलो, let's travel along with the midgut. Midgut के साथ में travel करते जाओ, and you'll be getting all the branches. Just keep on traveling along with the midgut. You'll get all the branches. Okay. चलो, let's start the traveling too along with the midgut. Superior mesenteric artery will give a branch here, and this branch is between the pancreas and duodenum. Pancreatico-duodenal, but this time which ones are inferior? So I'll just put a star mark here, and this artery I'm writing here, star mark, inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. Sure. By this, I'm done with what, guys? I'm done with the duodenum. After duodenum, what do you have here? Jejunum. It is giving like many arteries to jejunum. Jejunal artery. And after that, it is giving like many arteries to the ileum. Ileal artery. Wow. I'm telling you, it's like a little bit easy right now. Just keep on going along with the midgut. Duodenum हो गया, jejunum हो गया, ileum हो गया. And now there will be one artery here, guys, and the name of the artery is beautiful here. After ileum, there will be an artery given here, and this artery is supplying to the last part of the ileum, and even cecum, and even appendix, as well as the starting part of the colon. Okay, that means basically what is this artery supplying to? This artery is supplying to this entire transition well apart from small intestine to large intestine. So it is supplying to the ileum, cecum, appendix, and the starting part of the colon. That's why doctors kept the name as ileo, from ileum to colon, colic, ileocolic artery. Wow. Ileocolic artery. And now in the colon, sir, ascending colon. Remember, ascending colon here, it will be supplied by this artery here, and this will be the right colic artery. And finally, chalo, let us end this journey by supplying to transverse colon. And transverse colon will be supplied by, this one will be the middle colic artery. M for middle colic artery. And that ends your midgut, that ends the branches. Let us do the revision again. So चलो सर एक बार फिर से ना स्टार्ट करते हैं. Let's start the entire journey of midgut. Midgut will be starting from your duodenum, second part of duodenum. So number one, inferior pancreatico-duodenal artery. After duodenum, jejunal arteries. After jejunum, ileal arteries. After that turning part, ileocolic artery, and then ascending colon, right colic artery, transverse colon, middle colic artery. That's all. These are all the branches given by superior mesenteric artery. And now, my dear doctors, inferior mesenteric artery will be supplying to the last and final topic now. The inferior mesenteric artery will be supplying to what? It will be supplying to the hindgut. And hindgut will include what only? It will include the descending colon. Chalo bolo, which colic artery? Which colic artery? Here it is right and then middle, and now it will be left. Yes. Left colic artery. After that, sigmoid colon, sigmoidal artery. After that, sigmoid colon, rectum, rectal artery. Okay. So these arteries will be given by the inferior mesenteric artery. Let us write that and finish it off. Inferior mesenteric artery will be supplying to hindgut. What are the branches given, sir? Hindgut. Left colic artery, sigmoidal artery, and then superior rectal artery. These are all the branches given by inferior mesenteric artery, sir. Done. So that's a huge part done, and many questions coming from here. Many questions are coming from here. So if you observe in your books right now, guys, the foregut part will be like the most difficult wala part. Entire foregut is supplied by celiac trunk. Then midgut a little bit moderate, and hindgut is like easy. Okay, and all these three are the ventral branches of abdominal aorta, जहाँ से हमने start किया था. Okay, guys, okay with this one here. So we'll do one thing here. We'll take a small break here right now, and after the break, we'll continue. Okay. Welcome back here, Reno, guys. Now everyone here right now, guys, let us continue our discussion right now. So by this what happened, all the important topics has been discussed actually. Okay? And now there are like few more topics left out, guys, a little bit important one, and we'll discuss that and we'll finish it off. Okay? Now, as I told you from the organs, first of all, one thing, confirm me, everyone, are you able to listen to me now? Are you all able to listen to me? Sure. Come on, guys. Okay, fine. So as I told you, like not many questions will be coming from the organs. Organs वाला part मैंने आपको already बता दिया है. Now mainly what we are going to do right now, guys, let us discuss about the embryology part, guys. Embryology part. So after the break, I hope you are like fresh right now. So first we'll discuss the embryology part, and then later on we'll discuss some miscellaneous here and there, few important points regarding some of the organs and all, like liver, kidney and all those things. Not many questions will be coming from that one, and if any question comes you can easily manage. So let's begin with the embryology first of all, guys. Okay, so heading लिखो sir, gut embryology. Please write on the heading as gut embryology. Yeah. So I hope everyone is able to see me right now, guys. So please write on the heading as gut embryology. Now what is there here in the gut embryology? Let me tell you people in detail. Now my dear friends, for example, if this one will be the embryo here right now, guys, and this will be the yolk sac here, and this will be actually whatever I have drawn in black colored line is actually the ectoderm, and imagine this red colored one here to be the endoderm. Endoderm is the one which is going to form your foregut, then the midgut and the hindgut, guys. Okay, so this red colored one here will be the endoderm, and that is going to form the foregut and then the midgut and then the hindgut. Hindgut will give this extension here, this is known as allantois, and whereas the midgut will give this extension here, that is nothing but vitello-intestinal duct. And now first one small topic but very important topic I want to teach you people here is that about the umbilical cord. This here will be umbilical cord, and in your exam, MCA exam, they are asking many a times about the contents of umbilical cord, guys. Number one content of the umbilical cord will be vitello-intestinal duct. Number two here will be the allantois. Number one, vitello-intestinal duct. Number two, allantois. We can clearly see that. Now surrounding these two will be a jelly-like substance, and that jelly-like substance will be Wharton's jelly. Wharton's jelly. And then number 4 and number 5 you have to write down about the umbilical artery and umbilical vein, and we have already completed the CVS embryology, so you people are like really perfect in that one. You'll be having right and left umbilical artery. You have got like both the arteries, but what about the vein, guys? Vein, only the left umbilical vein will be there, sir. This is something extremely important. Try to recall from our previous classes the CVS embryology. In CVS embryology, I already told you the right will regress and left is left. So the right umbilical vein is gone, regressing, and the left umbilical vein will be left there. Is it okay? So the right and left umbilical artery, and then there will be left umbilical vein. So umbilical cord, the contents of umbilical cord will be vitello-intestinal duct, and then the allantois surrounded by Wharton's jelly, right and left umbilical artery, and the left umbilical vein. All this will be the contents of umbilical cord. Now once you are done with this one here right now, guys, now let us deal with one by one the foregut, the midgut and the hindgut. In foregut, what I am going to do is I am now going to take the transverse section of the foregut, sir. I am going to take a transverse section of foregut. Should I remove this diagram? Now first of all, let's deal with the foregut. And in foregut, guys, whenever you take a transverse section, outer black colored line here will be your ectoderm. Again, so this is nothing but your ectoderm, and this ectoderm is nothing but going to be forming your future body wall. And inner you'll be having like endoderm. So I'm just marking here star mark, and this star mark I'm writing here. This one will be endoderm, and remember endoderm is going to become the future gut, your foregut, midgut, hindgut. In between the ectoderm and the endoderm, my dear friends, will be having mesoderm, and the mesoderm is going to form your peritoneum. Okay, so in the abdomen here it is going to form peritoneum. The peritoneum, which is going to cover the organ, visceral peritoneum, and then the one which is outside here will be the parietal peritoneum. Okay, so there will be a visceral peritoneum here, and this will be the parietal peritoneum here. The visceral and the parietal peritoneum are connected to each other with the help of double layer of peritoneum. With the help of double layer of peritoneum. And if it is this ventral side here right now, guys, and if it is the dorsal side, we are actually taking the transverse section, hai na? So now my main intention is about this one here right now. This one will be known as the mesentery. So this one will be known as the ventral mesentery, and this will be known as the dorsal mesentery. So I repeat again once more here right now, guys. There will be visceral peritoneum and there will be a parietal peritoneum. Visceral peritoneum and the parietal peritoneum are connected to each other with the help of double layer of peritoneum, and that double layer of peritoneum in general it is known as mesentery. Mesentery. Now if you are comfortable with the terminology here, I'll do one thing. In one diagram I'll simplify everything for you, okay? Like in one diagram, like about the liver, spleen, everything, let us concise it, in one diagram here, right? So I remove this right now, guys. I'm going to draw the same diagram again, but without any names now. You already know the names. So imagine this one to be your ectoderm, body wall, endoderm, gut, and then there will be peritoneum. This will be the visceral peritoneum, and this here will be the parietal peritoneum. Let me just draw it a little bit properly. The visceral peritoneum and the parietal peritoneum are connected with a double layer of peritoneum here, and this double layer of peritoneum is known as mesentery. So this one is the ventral aspect and this one is the dorsal aspect. Okay? And now, my dear friends, let us learn about everything in one diagram. First of all, about the liver. Remember, liver develops in ventral mesentery. MCQ number 1. Imagine that is your liver. Liver develop in ventral mesentery. Okay, fine. After the formation of liver, then what is going to happen to this ventral mesentery then? It is going to divide into two ligaments, one in front of the liver and one will be like behind the liver. The ligament which is in front of the liver will be the falciform ligament. I think you have learned this in the gross anatomy. Falciform ligament. And the ligament which is actually behind the liver here, this one will be lesser omentum. So that is why I am telling you repeatedly about the organs. Nothing much to learn. Here itself we are covering. Again, when you learn the topic of liver, what is there in front of the liver? Falciform ligament. What is there behind the liver? Lesser omentum. And the beauty of learning like this, now you also know, sir. Come on, tell me. Falciform ligament is derived from where? Answer me, guys. Very nice. You can see in our diagram very clearly, not even the gross anatomy, Even the embryology is also done, sir. Falciform ligament is derived from ventral mesentery, and even lesser omentum is also derived from the ventral mesentery. Lesser omentum is also derived from ventral mesentery. Now, once you're done with this one, where is the spleen developing, guys? The spleen will be developing in dorsal mesentery. Spleen will be developing in which mesentery? Dorsal mesentery. And once the development of the spleen is done, what is going to happen to dorsal mesentery? Again, the same thing. It is dividing into two ligaments here. One here and this one here. So one in front of the spleen and one behind the spleen. And guys, this ligament here, which is in front of the spleen, will be gastrosplenic ligament. This ligament here behind will be the spleno-renal ligament. Spleno-renal ligament. Done. Okay. So why the word is used as renal here right now? Why? Because we all know dorsally यहाँ पर क्या होता है sir? Kidneys form होती हैं. If the kidneys are forming here, definitely renal. Spleno-renal ligament. So now let us revise again right now, guys. For the last and final time, liver develops in which mesentery? Ventral mesentery. Spleen develops in which mesentery? Dorsal mesentery. After the formation of liver, in front of the liver, which ligament? Falciform ligament, and behind lesser omentum. So these two will be derived from which mesentery? Ventral mesentery. Gastrosplenic ligament and spleno-renal ligament, these two ligaments are derived from the dorsal mesentery. Done. So in one diagram, everything is made damn easy, crystal clear. Is it okay? Now after teaching this, some of the students will be having a doubt in the mind. Okay, sir, you are telling that liver is in the front here right now. Liver is in the front here right now, ventral aspect. Is our liver in the front here? No. Sir, you are telling that spleen is behind here right now. Piche. Is the spleen behind here? No. Spleen is towards the left side here right now. So there is a slight confusion, sir. You are telling liver सामने होता है. Liver कहाँ पर सामने होता है? ठीक है ना? Now liver is not in the front and spleen is not behind here right now. So my dear friends, what is going to happen? The answer for that confusion is after the formation of the liver and the spleen. Come on. After the formation of the liver and the spleen. Hello, don't get disturbed right now. After the formation of the liver and the spleen, now what is going to happen? Rotation will occur and the liver will come here. Okay? And the spleen will go here. Oh my God. That means our foregut is going to rotate in which direction? Clockwise. How much? 90 degrees. And here comes the next topic. So please write on the heading as rotation of gut. Beautiful. So write on the heading there as the rotation of gut. Foregut, midgut and hindgut. What about the foregut, guys? Will it rotate? Yes, 90 degrees. In which direction? Clockwise direction. What about the midgut, guys? Will it rotate? Yes, 270 degrees. In which direction? Anti-clockwise direction. And what about the hindgut? Hindgut will not rotate. Is it becoming easy now? Hello? So foregut is going to rotate how much? 90 degrees in clockwise direction. And midgut is rotating how much? 270 degrees in anti-clockwise direction. And hindgut will not rotate. Okay? Already about the foregut, I told you here itself, guys. Foregut के बारे में तो मैंने आपको यहीं पर बता दिया है. It is going to rotate clockwise 90 degrees. Now let me tell you about the midgut. How it is going to rotate 270 degrees anti-clockwise. ठीक है? Nothing to worry about the hindgut. Hindgut तो rotate ही नहीं होता है ना? So now please, my dear friends, write on the heading there as midgut. Guys, just before the break, I told you about the midgut. Try to recall. Midgut will include what? It will include the duodenum, jejunum, ileum and all those things, And there will be long coils of jejunum, long coils of ileum, and they cannot be accommodated inside. Now, because this cannot be accommodated inside the abdomen, that midgut will actually come out. Oh my God. So what is going to happen, sir? The midgut is actually going to come out here like this. Man, look, it is like duodenum, jejunum, ileum. And here, for example, there is a cecal bud and appendix. cecum forming here. Just मान लो. Now our midgut is going to come out from where, sir? It's going to come out from the opening. Which opening? Obviously umbilical opening. And after coming out from the umbilical opening, our midgut is going to rotate in an anti-clockwise direction 270 degrees. What is the artery that will be supplying to the midgut, guys? The artery that is supplying to the midgut here will be your superior mesenteric artery. Okay, it is rotating around the superior mesenteric artery. That was the question in the exam. Midgut is rotating 270 degrees around superior mesenteric artery. And now, my dear friends, what is this known as actually? The midgut coming out of the umbilical opening and rotating and all. That is actually hernia. That is actually hernia. Normally midgut कहाँ होना चाहिए? Abdomen के अंदर. If it is coming out of the abdomen, it is changing the position. Changing the position, hernia. But is it like pathological hernia or physiological hernia? It's like something disease or normal functioning? Obviously normal functioning. If it is like normal functioning, physiological hernia, and therefore this entire concept or phenomenon is known as physiological hernia. So my dear friends, when will physiological hernia occur? The physiological hernia will occur during the 6th week, week 6. Achha, after coming out, it will rotate 270 degrees and again go back. So when will the physiological hernia reduce? Reduction of physiological hernia, 10th week. So our midgut is going to come out during 6th week and rotate 270 degrees in anti-clockwise direction. Again it will go back during 10th week. In some unfortunate babies, it will fail to return back. It will fail to reduce back. And that condition is known as omphalocele. So therefore, failure of reduction of physiological hernia. This condition will be known as your omphalocele. So the baby is going to take birth with the contents, the intestinal contents lying outside. The physiological hernia will occur during 6th week and it is going to reduce by 10th week, and if it is failing to reduce back inside, okay, then it is known as omphalocele. Arish, that black one is cecal bud, that is cecum. Cecal bud, cecum and appendix. Okay, so that is about the midgut that you have to remember. So we are done with the foregut and then we are done with the midgut, and now welcome to the hindgut. Done? If it is done, should I remove this? Yes. And now please write on the heading as hindgut. And what we are going to do is, out of this entire diagram of the embryo here, foregut ho gaya, midgut ho gaya. Now welcome to the hindgut. So I am going to remove this part from here. So this much diagram. ये वाला diagram हम draw करते हैं. So therefore now please write on the heading there as hindgut. And along with the hindgut, we are going to study about the urogenital system. Development of the hindgut along with the urogenital system. What's happening during 270 degree rotation and reduction in midgut? What's your question? I explained you clearly now. Midgut is going to come out, rotate 270 degrees and go back. What's the point? I told you very clearly, midgut will have long coils of duodenum, long coils of jejunum, ileum and all. And all that long coils of jejunum, ileum cannot be accommodated inside the abdomen. Try to just imagine it's an embryo, 6th week. 6th week is just 1.5 months. very early in pregnancy, and at that time embryo is very small, cannot accommodate the coils inside, so that will come out, rotate and again go back. There's a point. There's a point. Bharat, are you special? It happens in all. I'm speaking about the normal. I'm not speaking something abnormal things. कि किसी में होता है किसी में नहीं होता है. Everyone. It happened in you and happened in me also. It's the normal physiology, normal development it's taking. Chalo, now welcome to the hind gut right now, guys. So I'm now going to draw only the hind gut wala part. This one is hind gut here, and hind gut is giving an extension. That extension is known as allantois. So hind gut, and it will give an extension here. That extension is allantois. Hind gut will give an extension as allantois. Now, my dear friends, what is this black colored line here right now? Ectoderm. And what is this red colored line here? Endoderm. And in the middle of this ectoderm and the endoderm, you'll be having what here? Mesoderm. And that mesoderm will extend further. Mesoderm आगे बढ़ेगा, and that mesoderm is going to divide this one. So whatever yellow colored one I'm drawing here, that is nothing but your mesoderm. Mesoderm is going to divide. What will happen for the development? This will be your, ectoderm. And because the mesoderm is dividing here right now, guys, the hind gut will be separated apart. And now this is going to form the rectum. Hind gut will part, rectum, anal canal, anus and all. And this allantois is going to become a sinus here right now, and this sinus is known as the urogenital sinus. And I want everyone to concentrate here right now. This topic is a little bit confusing topic. You have to correlate a lot of things, so don't take anything easy right now. And if you miss anything in the middle, you have to again come from the beginning. So please listen. So I'm now drawing only the hind gut parts. Okay, only the hind gut. So hind gut will be having an extension known as allantois here right now. Now what is going to happen? The mesoderm is further extending and dividing the hind gut and the allantois. So therefore hind gut is going to become what? Rectum, anal canal and all. Allantois is going to become what? Urogenital sinus. And my dear friends, just keep in mind from here onwards only. Okay. If you want to write, you can write, but just keep in mind, urogenital sinus is the one which is actually going to form your urinary bladder only. Just make the concept ready. Sir, why it is going to form urinary bladder? Yes, yesterday we have learned pelvis and perineum topic, and I have showed you अगर rectum होगा तो rectum के बिल्कुल आगे क्या होगा? In front of the rectum, what do you have? Urinary bladder. So urogenital sinus is going to form urinary bladder. Urogenital sinus is going to form what's a urinary bladder, of course. Just keep in mind. Now one diagram is done, sir. Now let me give you one more diagram, sir. ये एक हो गया है. Now the second one. Please recall general embryology topic that I have taught you before. First week, second week and the third week. In third week, 3 germ layers, ecto, endo, meso. In that we have learned about intermediate mesoderm. Intermediate mesoderm, okay, the other day during general embryology we left it, hai na? And now what we are going to do is we are going to see what is the further development. Intermediate mesoderm is actually going to again divide into 2 parts, or it is going to form 2 parts. Nephrogenic cord. Number 2, it is going to form the genital ridge. Intermediate mesoderm is going to form like 2 parts, guys. Nephrogenic cord and the genital ridge. Nephrogenic cord and the genital ridge. Okay. And now I'll give you some schematic diagrams here right now, guys. Man look at this is nephrogenic cord, and attached to that will be genital ridge here, right? Okay. Just schematic diagrams. For the sake of understanding, I'll just draw a simple diagram. Now the first thing that you should know is that genital ridge is the one which is going to form gonads. Okay. If genital ridge is going to form the gonads, guys, I'm going to tell you this topic a little bit slowly. So please try to understand at once. If the genital ridge is going to form gonads, guys, gonads means what? In the male gonads will be testes, and in the female gonads will be ovaries. And we all know whether it is, gonads means what? They are going to descend down. So what you do is imagine that it is already descended and it is gone. Now what is the only thing left out right now? Nephrogenic cord. And naam se samajh mein aa raha hai. From the name you can understand. Nephros means kidney. Genic means formation. Formation of kidney. Nephrogenic cord. Okay. Okay. So now comes the final conclusion here right now, guys. Urogenital sinus from our diagram number 1 is going to form urinary bladder. Think about this now. And from the second diagram here, nephrogenic cord is going to form kidney. Forget about genital ridge. वो तो descent हो चुका है. Now this is going to form kidney. And we all know our kidneys, the right kidney and the left kidney, they are connected down to the urinary bladder. So now we need to connect the nephrogenic cord with urinary bladder. Nephrogenic cord, that is kidney, with the urinary bladder, that is urogenital sinus. Are you getting me? Do you have any problem here in the very first diagram? Let me know, then I'll remove this diagram, sir. अब हमको क्या करना है सर? इन दोनों को कनेक्ट करना है, नेफ्रोजेनिक कॉर्ड, एंड देन वी हैव टू कनेक्ट दैट विद द यूरोजेनिटल साइनस. Come on, start drawing the diagram with me now. Imagine this is nephrogenic cord. Imagine this is one more nephrogenic cord. There will be two nephrogenic cords. They are going to form like two kidneys. Nephrogenic cord will be in turn divided into three parts. Imagine this part to be the pronephros, this middle part to be the mesonephros, and the third part here to be the metanephros. That is about nephrogenic cord. And below here, draw the diagram of urogenital sinus. Imagine this one to be the urogenital sinus. Okay? And this is what I am telling you about, my dear friends. Nephrogenic cord here and the urogenital sinus here. चलिए सर, दोनों को जोड़ते हैं. Let's join them together. Now what is going to happen here? There is a duct coming from the mesonephros part, and that duct is coming and joining here. There is a duct coming from the mesonephros part and coming and joining here. What will be the name of this duct? Obviously, mesonephric duct. And not only this, the last part of the mesonephric duct will be absorbed inside, and therefore it is going to form what only? That is going to form the trigone of the urinary bladder. Okay. So, my dear friends, I'm trying to make the topic very much easy for you. Okay. Urinary bladder. First, write down their heading as urinary bladder. Let us see the formation of urinary bladder. So topic number 1, urinary bladder कैसे form होता है? Write down there, urinary bladder is derived from urogenital sinus, except trigone. Next point, trigone is derived from the mesonephric duct. Wow. Wow. Crystal clear. Nephrogenic cord is going to form the two kidneys. I'll tell you how they are going to form. And urogenital sinus is going to form urinary bladder. And we know already from our childhood, the kidneys are going to join with the urinary bladder. How they are going to join? Mesonephric duct. Last part of the mesonephric duct is absorbed inside to form trigone. Entire urinary bladder is derived from where only? Urogenital sinus, except for trigone. And trigone is derived from mesonephric duct. I am done with one topic. Are you all done with the writing part? Once you are done with the development of the urinary bladder, now let us see the development of kidney, guys. Okay, let's see how the kidneys are forming. Development of kidneys. The first thing that you have to decide is that, can you please answer me? In human beings, the kidneys are formed from pronephros or mesonephros or metanephros. Which part? Human being kidneys are derived from pro, meso or metanephros. Pro, meso or metanephros. Chalo, look here sir, everyone here. Remember my dear friends, the pronephros in human beings will degenerate. Gone. Mesonephros in the human beings will degenerate. Gone. That means in human beings, the human being kidney are derived from where sir? Metanephros part. Wow. So therefore my dear friends, now what we are going to do is, we are going to remove this metanephros part from here and let's see how the kidney is forming. So from this complete big diagram, let me remove only this much part from here, sir. Or this part from here, sir, metanephros part. So imagine this one here to be the metanephros. Guys, I am teaching you so slowly here. So please try to understand and don't ask me again right now, sir. I think you are understanding the link. If you miss anything in the middle and if you ask me again something, again we have to come from beginning. Listen carefully. We will not be able to repeat again and again, okay? That's why I'm telling you once and very aram se slowly. And what is this passing through the metanephros part, sir? This is nothing but our mesonephric duct. Okay? So basically what I'm trying to do is I'm removing this much part from it. Metanephros and mesonephric duct. चलो देखते हैं किडनी कैसे फॉर्म होता है. Mesonephric duct is going to give an evagination and that is going to go back and join here. And then again like this is. Oh my god. So mesonephric duct is going to give an evagination, a bud. And this bud here is known as the ureteric bud. Ureteric bud. And near the tip of the ureteric bud, the cells will multiply here right now, and these cells which are multiplying here right now, that is actually from the metanephros part. That is why metanephric. And in embryology, any cells which are multiplying, blastema. Okay. So there are two parts formed here right now, guys. Metanephric blastema and then ureteric bud. So the two new terms that you have to learn, okay, from the mesonephric duct there is ureteric bud, and ureteric bud is actually going to go back and join with the metanephric blastema. And now, my dear friends, hello, I want you all to imagine this in this diagram. And do one thing, don't do any changes in your diagram. I'm going to spoil this diagram. Everyone look here. Mesonephric duct is going to give rise to ureteric bud going and joining back. It is also going to form the ureteric bud. So this is also going to form the ureteric bud from here, sir. And it is also going to go back and join here. Okay. And near the tip of the ureteric bud, you'll be having the metanephric blastema, and here also the metanephric blastema. क्या बात है, मेरी नज़र से देखो, मुझे दो किडनीज नज़र आ रहे हैं, आपको नज़र आ रहे हैं? Are you able to see both the kidneys? And from the kidneys, yes, what is this which is going to go and connect with the already formed urinary bladder here? This is ureter. Ureter. Oh my God. So therefore, metanephric blastema and ureteric bud. Okay. And now just we need to remember what it is forming. Metanephric blastema, it is going to form the secreting part, sir. Secretory part of the kidney. What will be included in the secretory part of the kidney? Bowman's capsule, proximal convoluted tubule, loop of Henle, and distal convoluted tubule. You remember Bowman's capsule, proximal convoluted tubule, loop of Henle, and distal convoluted tubule. And from the ureteric bud, what is going to be formed, sir? Ureteric bud is going to form your collecting part of the kidney. And what is included under the collecting part? Remaining everything, sir. Come on. Collecting duct. Collecting duct will go and open into calyces. Minor and major calyces. And calyces will open into pelvis. And pelvis will continue down into ureter. So all this will be derived from ureteric bud. And all this will be derived from metanephric blastema, and together they are going to form your entire nephrons, and nephrons are going to make your kidneys. That completes about development of kidney in the easiest way possible, simplest way. Just confirm me if you are done. Wow. Chalo. Now once you are done with the kidney, development of kidney हो गया, and not only that development of kidney guys, we are even done with the ureter also. Ureter भी form हो गया, and urinary bladder तो पहले से form हो चुका है. So I am done with the development of kidney, I am done with ureter, I am done with urinary bladder. Now urinary bladder will continue down to urethra. Let us see the development of urethra. So first let us see the development of male urethra. Male urethra. And then we'll see afterwards the development of the female urethra. Male urethra will be approximately like 20 centimeters long, whereas female urethra will be short, that will be only 4 centimeters long. And my dear friends, can you please just recall and tell me, urinary bladder will be derived from where? Urinary bladder will be derived from which part? Yes, very nice. Urinary bladder will be derived from urogenital sinus. Except the trigone. Trigone is derived from where? It is derived from mesonephric duct. And actually, to be really frank, we should not even study this topic of development of urethra. Why? Just continue this below. Urogenital sinus will continue down to form urethra. हो गया sir topic. So even the urethra is derived from where only? Urogenital sinus. Now I hope you all know, yesterday only I taught you pelvis and perineum topic. Male urethra will be divided into 3 parts. First part is passing through the prostate gland, prostatic urethra. And there will be a small part passing from the deep perineal pouch, membranous urethra, and then finally the remaining will be in the penis, known as the penile urethra. Okay. And here only one point that you have to remember. Okay. So if anyone asks you, sir, tomorrow in MC exam, if they give you a question, urethra is derived from where only? From urogenital sinus. Nothing. The only one thing that you have to remember here is that, the trigone will not stop here. The trigone will continue, okay, down a little bit into the prostatic urethra. On which wall of the prostatic urethra? The posterior wall. The posterior wall of the prostatic urethra. And exactly we need to copy paste in the females here right now, guys. In the females, the urinary bladder is derived from urogenital sinus. And inside this, except the trigone. Trigone is derived from mesonephric duct. And in females, nothing much to learn here. This will just continue down to form the urethra, and urethra is very small, only 4 centimeters. And again the same thing. There is no division like prostatic or something like that. And the same thing here. The trigone will continue down onto the posterior wall. The posterior wall, the trigone will continue. Done. That completes your entire urinary system, sir. We are done with the kidney, we are done with the ureter, we are done with the urinary bladder and urethra. Now once you are done with the urinary system here right now, hope everything is clear. And now let us go towards the genital system, guys. In genital system, guys, you'll be having like 2 things. One is the Wolffian duct, another one is the Mullerian duct. Can you please tell me, out of Wolffian and Mullerian, which is going to form the male genitalia? Male. Yes, the name itself is telling us, Wolffian. Wolffian, male. It is going to form the male genitalia. And another name, yes, you can just remember from the name itself. It's very delicate and sophisticated, Mullerian. And Mullerian is going to form the female genitalia. And now let us see what is going to happen. It's like easy part right now, sir. Wolffian duct. Okay. Can you please tell me what is another name of Wolffian duct? From that time, whatever mesonephric duct that we are learning, that mesonephric duct itself is nothing but your Wolffian duct. Okay. Understanding? Paramesonephric will be the Mullerian one. Okay? So therefore, Wolffian duct is nothing but the mesonephric duct. Now let us see what will happen to the Wolffian duct in the male and what will happen to the Wolffian duct in the female. Now guys, you only told me just now, hai na? Wolffian duct is going to form the male genitalia. Then what should happen in the female? In the female, a remnant, and the remnant of that one in the female will be Gartner's duct. So Wolffian duct, a remnant in the females will be Gartner's duct. That kahani khatam. Now welcome to the Wolffian duct in the male. Male, what is going to form? Just remember one word. I'll tell you one trick here. Spermatic pathway. That means from wherever the spermatozoa is passing, that entire spermatic pathway will be derived from the Wolffian duct only. Chalo. Recall. Storage of spermatozoa, epididymis, derived from Wolffian duct. From epididymis, ductus deferens, Wolffian duct. From there, the seminal vesicles are derived from Wolffian duct. And then from there, the ejaculatory duct. From where, sir? Wolffian duct. So you just remember in mind one word, the spermatic pathway. जहाँ से spermatozoa pass होता है, and the entire pathway will be derived from Wolffian duct. That's the easy way to remember. So spermatic pathway includes the epididymis, the ductus deferens, seminal vesicles, ejaculatory duct. Okay, everything will be derived from the Wolffian duct only. Along with that, even include the prostate gland. Be a part of that. Prostate. Done. And now the last and final one, guys, Mullerian duct. Mullerian duct. Mullerian duct is also known as the paramesonephric duct. Paramesonephric duct, sir. Mullerian duct or paramesonephric duct. Let us see what is going to form in the male and what is going to form in the female right now. I hope you all know the Mullerian duct is going to develop into what? Female genitalia. तो हम सबसे पहले काम करते हैं. Let us do one thing here. Let's see in the males what is going to happen. If Mullerian duct is going to form the female genitalia, in the males, what should be there, sir? There should be a remnant of that. And the remnant in the male will be the prostatic utricle. Prostatic utricle. Okay. And then the appendix of testes. Out of this one, this is important here, already asked in the exams. So the remnant of Mullerian duct in the males will be prostatic utricle. And females, actually it is going to form, the Mullerian duct is going to form the female genitalia. So क्या form करेगा? It is going to form the fallopian tube, and then it is going to form the entire uterus, and then it is going to form the upper part of the vagina. Okay, so the fallopian tube here, and then the entire uterus here, and only the upper part of the vagina. So almost the internal genitalia of the female internal genitalia, fallopian tube, the uterus and the upper part of the vagina, all this will be derived from the Mullerian duct. Okay, done. Okay. So Wolffian is actually going to form the male. So in the female, remnant, and Mullerian is going to form the female genitalia. So therefore in the male, remnant. And guys, now if you are observing here, Mullerian duct is actually going to form only the internal genitalia in the female, and the Wolffian duct is going to form only the internal genitalia in the male. So they are actually concerned with the internal genitalia. What about the external genitalia? And now for that you need to remember like 4 words here right now, sir. So start writing. Genital ridge, and there is something known as genital tubercle, and then there is something known as genital swelling, and then there will be genital fold. And these 4 words are confusing the students like hell in the exam. And now let us see what are the derivatives. Genital ridge, already I told you it is going to form what's the gonads. What are the male gonads? Testes. And what is similar to testes in females? In females it will be ovaries. Genital ridge is going to form the testes and ovaries. Okay, gonads. Genital tubercle, it is in the males, it is going to form the glans penis. And what is homologous to the glans penis in the females? It will be clitoris. Genital swelling in the males, it is going to form scrotum or the scrotal sac, and homologous to that in the female will be labia majora. Genital fold is actually going to form the ventral aspect of penis, and homologous to that in the female labia minora. And that is about the external genitalia, and that is about which system? Genital system. So we are done with the urinary system as well as genital system, and before itself we have completed the foregut and midgut and hindgut. Okay, so that completes your gut embryology, urinary system embryology and genital system embryology. And in previous topic we are done with head and neck embryology and CVS embryology. So everything systemic embryology we have covered wherever it is coming. So done. I'll give you like 2 minutes of time here right now. Revise this topic. Then we are left out with few more miscellaneous topics, and then we'll do that and we'll finish it off. Okay. No, sir. Not only prepuce, the complete ventral aspect of the penis. Yes. I'll give you 2 to 3 minutes, sir. Just revise quickly. Left out, we are going to do that. Just revise the topic first of all, whatever it is done. Entire arterial system, diaphragm, abdominal aorta, celiac trunk, superior mesenteric artery, all like the major topics are done, guys, and even the embryology part done. And now let us wind up this topic by the venous drainage. In abdomen topic, when you learn about the venous drainage, we have to learn about 2 things. One is the portal vein, another one is inferior vena cava. One is portal vein, another one is inferior vena cava. So first what you do is, please write on the heading as portal vein, guys. Portal vein. And in portal vein, you can clearly see here that there is a vein coming from here. This vein will be the splenic vein, and then there will be a superior mesenteric vein. So the splenic vein and the superior mesenteric vein, both of them will join together to form your portal vein. And portal vein is going to drain the blood into the liver. Okay? So please write on the heading as formation of portal vein. So, okay? It is formed by splenic vein and superior mesenteric vein. So you have to remember that. Portal vein is formed by splenic vein and superior mesenteric vein. Portal vein is formed by splenic vein and superior mesenteric vein. Done. Come on, tell me, are you all done? And now, if you remember, like, before the break, we have learned about the arterial system. And in arterial system, my dear friends, arteries will always give what? Branches. And the vein always will have what's a tributaries. So now let us see what will be the tributaries of portal vein. Portal vein is going to drain the blood from the stomach. What is the artery for the stomach? Gastric artery. What will be the vein? Gastric vein. The portal vein is going to drain the blood from gallbladder, cystic vein, so something like that. Okay, na? So just write down the tributaries of portal vein. I'll tell you one by one. The tributaries of portal vein include the right and left gastric vein, cystic vein from the gallbladder, para-umbilical. Para means surrounding the umbilicus will be having para-umbilical vein, and finally the superior pancreatico-duodenal vein. So guys, whatever conceptual topics were there, I have completed all the conceptual things, how to make it easy, development of kidney and all those things. This is like you can understand here right now. There's no concept here right now. These are all the tributaries coming into portal vein. You got to memorize. Okay. So portal vein formation and what are the tributaries? Done. And now the next thing here will be the inferior vena cava. So please write on the heading there as inferior vena cava. Inferior vena cava, and the side heading you write down there as the formation. IVC, inferior vena cava, is formed by common iliac vein. You know? So here you can clearly see that there is a common iliac vein here and there is a common iliac vein here, and both the common iliac veins will combine together, and they are going to combine together and form a inferior vena cava. So common iliac vein, both of them will combine to form the inferior vena cava. It's easy. Again the same thing what you have to learn here right now, the tributaries. So please look at this here. So these are all the tributaries of the inferior vena cava, and we'll do one thing. Let us draw the diagram for that. Imagine diaphragm, and here you imagine this one to be your inferior vena cava, and this one is the inferior vena cava and the common iliac veins. Okay. And let us do one thing. Whatever is written here, all the tributaries, let us apply in this diagram. So number one, common iliac vein. Okay, no problem. I have already drawn here common iliac vein. Number two, lumbar veins. Actually, you remember lumbar arteries? Can anyone tell me lumbar arteries will be like which branches, guys? Ventral, dorsal or lateral? Lumbar arteries will be which branches? Dorsal. So they are actually present behind, so we can't draw in our diagram here right now. Just imagine lumbar veins will be dorsal. And now this is garbadi here right now. This is right testicular and ovarian. Testicular and ovarian means what's a gonadal vein. But the problem, the panga here is that it is only right. The right gonadal vein will drain into inferior vena cava. So we are done with the common iliac veins, we are done with the lumbar veins, then we are done with the right gonadal. After that, renal, right kidney, then there will be left kidney, and from the right kidney and left kidney, renal veins. And again there is a important thing here to note down. It's only right suprarenal. That means suprarenal gland here and suprarenal gland here. And from the right suprarenal gland only the right suprarenal vein will drain here, not the left one, only the right. And after that, inferior phrenic means what, guys? From the diaphragm, inferior phrenic vein. There is nothing like right and left, so दोनों भी drain करेंगे. And then hepatic veins, okay, there will be liver, and from the liver there will be hepatic veins. From the liver, hepatic veins. ठीक है, Prajwal, you can clearly see that inferior vena cava is formed by common iliac vein. It is formed by common iliac veins. Are you all done? Yes. So now look here, everyone here right now, guys. In this diagram, this is inferior vena cava, common iliac vein into inferior vena cava, lumbar veins into inferior vena cava, the right gonadal into inferior vena cava, renal veins into inferior vena cava, and only right supranal. So what is the problem here is that, what about the left gonadal and what about the left supranal? Left gonadal vein will drain into left renal. That's the concept here. And the left suprarenal vein will also drain into the left renal. Left suprarenal vein will also drain where only? In the left renal vein. Oh. And that is the only question possible in this concept. So left gonadal vein and left suprarenal vein will drain into the left renal. Left gonadal vein and left suprarenal vein drain into left renal. Okay? And before the break, we have actually completed the entire arterial system. And now after the break, we are done with the venous system, along with the embryology and some of the important organs which are required. And remaining things I hope you can easily manage. Is it okay? That completes your abdomen topic. Abdomen topic is done. With the embryology of foregut, midgut, hindgut, along with the urinary system as well as genital system, Mullerian duct, Wolffian duct, सब कुछ हो गया. And now let us see one miscellaneous topic here, right now, sir? After completing the abdomen topic, so mostly actually 99.99% we are done with the anatomy part here, sir. So some people are more worried about the neural crest cells derivative, glycosa. Neural crest cells derivatives. Neural crest cells derivative is actually very important topic. And secondly, the problem with this one is that you have to memorize this one. Why? Because they're actually forming varied things, different things. You will understand in a minute why I'm telling like that. There is no correlation between any one. Number one, it is going to form adrenal medulla. So adrenal gland will have outer part, that is cortex, inner part is medulla. Number two, neural crest cells are going to form the parafollicular cells. Parafollicular cells are also known as C cells, and these are present where? In the thyroid gland. So our thyroid gland will be having follicular cells and parafollicular cells. So parafollicular cells are derived from where? Neural crest cells. Not only that, number three, remember melanocytes. Melanocytes are also derived from the neural crest cells. Okay? And then yesterday or day before yesterday in the CVS embryology we have seen the bulbar septum is derived from neural crest cells. Bulbar septum, interventricular septum. So I hope you can see here adrenal gland, suprarenal gland, then thyroid gland, melanocytes, bulbar septum. There is no correlation with anything. So these neural crest cells, after the formation, they are going to migrate, and after migrating, they are going to form different structures. And not only that, it is going to form all the ganglions. So all these are the derivatives of the neural crest cells, at least that you have to remember for your MC exam, sir. That is more than enough about the neural crest cells. Okay? Adrenal medulla, parafollicular cells, melanocytes, the bulbar septum, okay, and the ganglions. Each and every ganglion in our body is derived from the neural crest cells. Each and every ganglion. The moment ganglion comes, close your eyes, mark the answer as neural crest. That's okay. So that is all about the anatomy part right now, guys. Upper limb, lower limb, thorax, abdomen, pelvis and perineum, neuroanatomy, head and neck, general embryology and systemic embryology. So hope these classes were useful to you. Thank you all. And one more thing, we are going to conduct a small test. Okay, हम लोग एक test conduct करेंगे. So I will let you know the date on which we are going to conduct the test, and I will give you, the question paper and everything. Okay, I'll give you the date and on which day we are going to conduct. I'll let you. Okay. Which I told you about the organs you can easily manage, so don't have to worry about the liver and all. In the liver, important thing was falciform ligament in the lesser omentum. That I have indirectly completed in the embryology part. Okay. That's all. And tomorrow we are going to begin